Hey, this is an audio only show. Play us in the background as you do whatever it is that you do. Thanks for listening and welcome to the Messy Mic. Please remember to like and subscribe. All right, let's get into it. So I'm going to jump right into it. Why is there boo boo in your food? Why is there contaminated food everywhere in the US causing a mass outbreak of Cyclospora, right? And explosive diarrhea? And we're just going to jump right in. Number one, in 2025, the CDC food net was downgraded. We're going to talk about all these downgrades. Our tax dollars are no longer buying us upgrades. We're only getting downgrades. For 3 decades, the Foodborne Disease Active Surveillance Network, FoodNet, a collaborative program between the CDC, FDA, and the USDA, and 10 state health departments, was the national gold standard for tracking foodborne pathogens. Okay. This has been spreading, and we have the food net who would track these things have been downgraded, right? So the administrative downgraded the food net's mandate, making the tracking of cyclospora specifically strictly optional in 2025 for participating states. Only salmonella and E. coli remain mandatory. So it was an optional thing for people to track. So are you going to track it? No. The result designed a system to serve an early warning baseline for national food spikes was effectively blinded to cyclospora right before the current season pick. So the system that we have right now did not know. We were blindsided because it's no longer mandatory to track cyclospora anymore. There was a massive USDA and CDC staff reduction. We don't have staff. USDA Department of Agriculture, right? Lost 18% of its workforce in the first half of 2025 alone, ultimately shedding 20,000, more than 20,000 employees. And this like severely damaged the agency's ability to do inspections. The CDC lost approximately 25% of its workforce. Over 3,000 public health workers are gone due to firings, forced retirement, attrition by the end of 2025. Next, starving states and local budgets. A massive $11.4 billion cut from state and local health departments dried up all the resources needed for boots on the ground to look into these things. Local health departments are the ones responsible for conducting painstaking interviews and food supply tracebacks required to stop an outbreak in its tracks. So that made this situation ripe for an outbreak when it's not mandatory to check it, but then you don't also have the staff. So you don't have the staff as the person who maybe still kept their job, and you still have to check for salmonella and E. coli. You're going to put your effort into what you have to do, especially if you don't have the help or other people to support checking for optional parasites. So we're fighting in the dark with something this small, which we had the gold standard. I mean, we were a country where we didn't have to think about the food that we ate on this level. Like, yes, there were salmonella outbreaks. Yes, we had E. coli outbreaks, but they were small, usually contained. Once they were discovered, a notice went out. We were aware. We were told what to do. There was a recall. We do not have that in the same way. We're now finding out, instead of being proactive, we're now finding out reactively, where people have to get sick and go to the hospital to find out if they now are part of a contamination that we didn't know about. And it just happened to be an uptick in cases. And don't get it twisted. There's states that don't have it. Could be because no one's going to the doctor to say anything. Just because the state doesn't have it does not mean they don't have it. It just means that it's possibly not reported. Some aspects of this outbreak too are just severe data log lags. Like the CDC's national lab confirmed 1,600 cases, while a single state like Michigan independently reported over 3,700 cases. So there's a lag in the data as well, as to how many cases are completely out there, as the CDC has one number, but the state of Michigan alone has almost double that number. And because these agencies can't pinpoint specifically the contaminated lot or farm that this is coming from, we just get a solution of avoid bag salad. They don't know which bag. We don't know which bag the bag came from. Meaning, I'm being silly, but meaning they don't know where the source of this is happening. They can't find it because there's a data lag. And so all we get as a solution right now is avoid bag salad. There's so many choices in bag salad. So it's really causing an unnecessary economic drainage to produce growers because there's some folks who their produce is probably all good. Nothing's wrong with it, but they can't sell it because we have to avoid all bag salad just because we can't pinpoint it. And this is also going to have an economic effect that will ripple. It'll be one of the many ripples. So at this point, federal officials and folks are like Agricultural Secretary Brooke Rollins have just pushed back against the critics. And, they're saying that and arguing that argues that funding constraints are required them to narrow their mandates to focus on heavily core pathogens like salmonella and E. coli. But they maintain that the CDC can still monitor this current outbreak trend through other national surveillance mechanisms and deny the cost cutting initiatives that put American consumers at heightened risk. They're just they're at this point, you can't point fingers. You have to say what it is. And now they're making PR statements saying, they're able to do salmonella, they're able to do, E. coli, that, the CDC can still monitor this, but really they didn't monitor it. They found out through people's hospital visits, which those people are on responsibility. They're responsible for that bill. They're responsible for that hospital bill. So it's costing everybody. You go to the doctor, you go to the emergency room, and you're now we're responsible for the bill on top of our premiums increasing. We are now paid to be the test bunnies of this experiment in which we are now deregulating our food inspections, right? So we are paying for it through our taxes, but then we also now have to pay for it an extra hospital visit to those who have to go. So public health advocates and agriculture industry leaders are arguing that when it comes to food safety, surveillance is the treatment, which is true. And without mandatory real time national data, officials can only document the economic and physical toll of an outbreak after the contaminated food has already been consumed, as I was saying. So that's just why there is boo boo in your food. Now, if you agree or disagree, sound off in the comments. If you have experienced this and have had a hospital visit, it would be great to hear your experience or how you've been feeling and any solutions that you've been doing to help you get through this. We would love to know. All right, wash those greens, y'all. Actually, just don't eat the greens.